We were honored to have a large delegation from the City of London, which is one of our successful fast-track cities in the 350 city network. I'm wondering what the award, the Circle of Excellence Award, means to the City of London and how you might leverage that for continued success.
Firstly, thank you so much for the award. It's a really lovely tribute to the city, so thank you, and thank you to the awards committee. And getting the inaugural award means an awful lot to us. I think in reality, it has 40 years of hard work have gone into this award. So this is really an achievement to recognise all 40 years worth of work, not just the Fast Track Cities initiative. And I mean that both from a medical scientific point of view. So we have an awful lot of incredible medics who've worked incredibly hard all the way through, including our chair, Professor Jane Anderson, who's worked in HIV for pretty much the entirety of that time. But also we have an incredible activist sector. And we've really tried to leverage that activist sector to make sure that the answer to our last 5%, having reached the 95, 95, 95, sits within the communities that need it most. So despite having done incredibly well in London in terms of relative figures to other cities, actually our challenge now is how do you get to those last people who need it most? And London still has enormous health inequality. We have communities that are very different from each other who don't get the treatment that they need and don't get the services they need often. And as statutory bodies, we've got, again, I want to pay tribute to the 4 statutory bodies that came together as part of Fast Track. So that's the Mayor of London's office, London Councils, what was Public Health England, and is now the UK Health Security Agency, and NHS England, to find a way to get into those communities. But more importantly, it's about those communities coming to us with some of the answers. And it's not about us prescribing what those answers are and having a true partnership. And actually, Fast Track Cities has enabled for London us to all get around that table as those constituent parts and have those conversations, and also to get some funding, which was incredibly helpful, but to also put that funding in the places it matters most, asking the communities, some of whom are here at this conference, what they think the best use of that money will be, but also giving them the best tools and techniques that the 4 statutory bodies have, so skilling up these amazing voluntary sector organisations. And finally, really, I want to pay significant tribute to the activism of the LGBT plus community in London, which has been extraordinary for an enormous amount of time, and who have triumphed again and again, and have really led the way for us to be able to say, well, we have the mechanisms to go into those other communities. Our black African diaspora is different from our black Caribbean diaspora, is different from our Latin American or our Asian communities. They all have slightly different needs. We still have problems with homelessness. So I think in terms of what the award means for us, I think it's great recognition that we're on the right track. And I think, and I hope, that we'll be able to use this as significant motivation for all those authorities that we are globally recognised as doing the right things, but also it will help us, I think, lift ourselves to be able to get to beyond those targets. And the one that concerns us most now is how do we make sure that people live well? And that is the real challenge that we've got going forward, and that's what we're looking forward to trying to solve together. And I think it's amazing to be here and talking to other cities to see what they're doing and sharing that knowledge. Finally, I just want to thank everyone on the leadership team. So Professor Jane Anderson, Professor Kevin Fenton lead our great teams. And I think we will be able to use this to go further and possibly faster. And as the health system in England changes and in London changes, we'll be able to cite this as a way to work together as collective organisations in the right way.
Well, we at the Fast Track Cities Institute are in awe of everything that London has accomplished. You are at the top of the leaderboard as far as the programmatic targets for the initiative. But we also respect the humility that you show as a city and as stakeholders, understanding that some people are still being left behind, and that's an extra effort that we need to put into place. And you're being honored for both those things, your successes and the challenges you're facing, then the reality of the COVID-19 pandemic and how you've managed to maintain a continuity of HIV services.
That's very kind of you to say, and I thank you again on behalf of everyone on the leadership group and everyone who's involved in it. But we are starkly aware that we still have significant challenges. There is not going to be a a magic time where we suddenly hit the numbers and everything's okay. And as our statutory authorities, we are all working incredibly hard with whatever our own limitations are, but actually the city response that we've been able to marshal through Fast Track Cities does enable us to have longer and harder looks at those problems, and it's just an honour to be part of a system and actually to be asked questions by other cities about what they can do, but also we can learn from everyone else who's here in very different circumstances. And yeah, gives me and a lot of other people a great amount of joy to be able to work on the programme. And as I say, we're merely following 40 years of incredible work medically and that activism. So yeah, thank you very much again.
Well, congratulations to Fast Track London.
Thank you.